My name's Dr. Gomez. I'm a cardiologist who specialises in heart rhythm problems, and I'll discuss an implantable cardiac defibrillator, or ICD, today. The best place to start this discussion is to look at the heart and the overall heart structure, and also the function of the electrical system in the heart. So if I draw your attention to this model, the heart's made up of 4 chambers. Here, all 4 chambers. The right and left atrium are the top chambers, and the right and left ventricle are the bottom chambers. The ventricles are the pumps that squeeze blood out to the rest of the body. If we look to a diagram of the heart, which I'll draw here very roughly, with all 4 chambers, the top chambers, the atria and the ventricles, and then draw in the electrical system. There's the sinus node, which we can think of like the spark plug in your car. There's the AV node, which we can think of as a fuse box, and then there are 2 wires that feed the bottom of the heart. The normal activation of the heart will be from the top down to the bottom, top and then the bottom. And on an ECG, what we see when we do a cardiograph is activation of the top and bottom. This is called normal sinus rhythm. Patients who have an ICD or have been recommended an ICD will have, in most cases, a risk or have documented a life-threatening heart rhythm disturbance. And that would be related to the heart beating too quickly in most cases. A treatment for this situation, which can cause a cardiac arrest, is an ICD. And we'll discuss the ICD implantation procedure and the risks for that now. The implantation procedure involves a general anaesthetic in most cases. After a patient is put to sleep with the general anaesthetic, a small incision is made under the collarbone in this region. Space is made for the defibrillator, which is called a pocket, and then wires are introduced into the vein under the collarbone. In most cases, there will be at least 1 wire which will attach to the bottom of the heart. That will be in all cases. We'll have a wire at the bottom of the heart. In some cases, we may have a wire at the top of the heart, or even a 3rd wire that runs to the back of the left side of the heart. The wires attach to a battery, which is a generator. This is a typical ICD generator or battery. Those wires will attach back up to the battery. The generator or battery will be put into the wound. The wound will be sewed up, and then the procedure will be complete. Testing of the ICD is performed in many cases, and that will involve inducing or causing a dangerous heart rhythm disturbance and testing that the defibrillator can shock the heart back to normal rhythm. There are 2 ways that the ICD works to protect people from life-threatening heart rhythm problems. One is by shocking the heart, and that would be similar to what is seen in patients having a cardiac arrest, if you've seen that on TV with paddles placed across the chest, where a shock is placed into the heart, but instead of that being performed externally, a defibrillator is able to deliver that treatment internally and potentially to deliver life-saving treatment. The other way a defibrillator can work is by delivering extra heartbeats into the heart in order to stop a short circuit in the heart. And those extra beats are delivered through the wire that attaches to the bottom of the heart. There are risks associated with an ICD implantation, as you can imagine. Bleeding and infection can occur from where the incision is made at the top of the heart. There is a small chance of damaging the veins under the collarbone, where the wires are passed into the vein. There's also the small chance of damaging the veins on the way down to the heart or the heart itself, causing bleeding around the heart. There's also the small chance of either of the two wires, if two wires are placed, moving and requiring a second procedure. If we add all the risks up of ICD implantation, the overall risks are between 1 and 2%. The usual expectation is that this procedure would be performed safely and without complications, and most patients would be discharged the following day after their procedure with no problems. There is a driving restriction after an ICD is implanted, and the time after an ICD is implanted that for driving restriction depends on the individual case and is best discussed with a heart rhythm specialist or your cardiologist. The battery for the ICD or the generator will need to be changed, and how long the ICD battery lasts will depend on several factors, including the number of wires that are used for that ICD, the amount the ICD is stimulating or pacing the heart, because an ICD can also work as a pacemaker, and whether or not you deliver or receive a shock from the defibrillator. But a typical time that a defibrillator battery will last will be between 6 and 8 years. There are some other special considerations with having an ICD, and that involves driving restriction after you receive a shock from the device. If you're unlucky to have a heart rate rhythm disturbance that's life-threatening and receive a shock from the device, there's a minimum of 1 month driving restriction after that event. Other things to be aware of with an ICD is the fact that the ICD itself is a computer. Sometimes computers get things wrong, and people can occasionally have a shock from their defibrillator for non-life-threatening heart rhythm problems, or in some cases have a shock from the defibrillator related to a problem with one or two of the wires attached to the ICD. We call these shocks inappropriate shocks. Thankfully, they're rare and would typically occur less than 2% of cases per year that an ICD is fitted. I'm happy to discuss ICD implantation or other aspects of the device should you wish. Thank you.